Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then carbidopa or benzerazide. Okay, this carbidopa or benzerazide. This carbidopa or benzerazide is a peripheral decarboxylase inhibitor. This carbidopa or benzerazide is administered along with levodopa, and it will increase the half life in periphery. Okay, because it increases the half life in periphery, that is peripheral decarboxylase inhibitors. Actually carbidopa or benzerazide will inhibit the we can say that it inhibits the peripheral conversion of levodopa, and thus it will help the levodopa to cross the blood brain barrier. So as a result, more amount of levodopa crosses the blood brain barrier. Because more amount of levodopa crosses the blood brain barrier, so more amount of levodopa is available for the central action. So it also reduces the, so once you have more of the levodopa is available for central action, it reduces the dose of levodopa to almost 1/4. So advantages of adding levodopa with carbidopa with levodopa, if you see, the main advantages are: one, it increases the duration of the action of drug, it increases the bioavailability of the drug, the dose of the levodopa is decreased on adding the carbidopa, and the nausea and vomiting which is seen with the with the levodopa is decreased. On using carbidopa, the nausea and vomiting with levodopa is reduced, and it also reduces the cardiac effects of levodopa, and it also minimizes the on off effects are also minimized. Then what are the side effects of levodopa, drawbacks of levo or of carbidopa? Carbidopa will cause psychiatric side effects are more, it causes more psychiatric side effects. Then it results in postural hypotension can occur, and involuntary movements are also increased with on using the carbidopa. And carbidopa does not prevent the CNS side effects like tremors, dyskinesias, and hallucinations is not prevented by carbidopa.
thank you and thank you for watching.